Now, I have to tell you, it's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
Well, Obamacare is terrible. It's terrible. And for the last 8 years, I've been saying that. And I've been saying it over and over when I was in office and now.
So just a yes or no, you still do not have a plan?
Well, I have concepts of a plan, which is like an idea of a proposal or a design of a scheme. I like to think of it as suggestions of a project, the recommendation of an intention. In simpler terms, it's the aim of a goal. It's the aim of a goal, the brainchild of a thought. And I'm a stable genius, not like her. But quite honestly, no one knew how complicated healthcare was going to be. Nobody knew that. There's a lot of people in the U.S. that don't have health insurance. No one ever talks about that.
It's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
Hello, everybody. It's Mr. Robbie here. Can you believe it? I think we can call this maybe to paraphrase or maybe to steal a line from Shakespeare. We might be able to call this December and January the winter of our discontent. And I mean that. Yes, I mean that. Literally and figuratively. Can you believe, really, can you believe we have to deal with this? And I say we, I mean the entire world. We, the world, has to deal with this clown for another 4 years. 4 years. Those of you who remember, and I hope most of you do, the pandemic fiasco, and we're not going to go into it because we know all of the facts. We know that he messed everything up. We know that, and that's, we're not even going to argue that point anymore. But when you take a look at his campaign, which lasted the last 4 years, his second presidential campaign lasted the last 4 years, and I have been hard-pressed to find any clips where he has said anything of substance regarding any specific policy. Yeah. I don't think you can. I don't think it's possible. One major thing that he has talked about since before he even became president the first time was repeal and replace Obamacare. So repeal and get rid of Obamacare and replace it with something much better. And it was always, we're going to have it in 2 weeks, that we're going to give it to Congress in 2 weeks. 2 weeks, 2 weeks, 2 weeks. It was never the same with the what was that, Industry Week or whatever that was, the Infrastructure Week, right? Infrastructure Week never happened, and repeal and replace Obamacare never happened, and the Obamacare called the the Affordable Care Act. Now, I live in Switzerland, and we don't have that here. And in a little bit later in this video, I will explain to you how the insurance here works, just basically because, as we know, and as Trump said, who knew that healthcare insurance was so hard, so complicated? Apparently, he didn't know, although he said he knew he could just fix it, and that was that. Just repeal and replace. Remember, he said in the debate.
I have concepts of a plan, which is like an idea of a proposal.
He has concepts of a plan for healthcare. So the last 8 years, his first 4 years in office, and the last 4 years, he's always promised he has a plan. It's going to come. We've got it already. And now he only has concepts of a plan. So like I said, I live in Switzerland and we don't have the ACA here. We don't have the Affordable Care Act here. I am American. I'm not covered by it because I don't live in the United States. But what I would like to do is first talk a little bit about the ACA, the Obamacare, what it's like, and I had to do some research, and it's only basic information. Okay, and then I'm going to compare it to the Swiss system. Now, what I found out, and because I'm not in the United States, it doesn't pertain to me, but under the Affordable Care Act, people with pre-existing health conditions can obtain health insurance. That is the same in Switzerland, and I will get into that a little bit later. Key provisions of the ACA: guaranteed coverage. So I don't know what is wrong with that. Insurance companies cannot deny coverage or charge higher premiums because of pre-existing conditions. Nothing wrong with that. I don't see anything wrong with that. No waiting periods. Insurers cannot impose waiting periods for coverage of pre-existing conditions. Again, I see nothing wrong with that. Those first 2 points, I don't think they need to be repealed or replaced with anything. Again, I'm not an expert on insurance, but these 2 points seem very good and valid to me. Next point, essential health benefits. All ACA compliant plans must cover essential health benefits such as prescription drugs, hospital stays, and mental health services, regardless of any pre-existing conditions. Again, all of that sounds excellent to me. I don't see any problem with that. Next point is about Medicaid. Again, I live in Switzerland. I don't have Medicaid. It doesn't pertain to me, and I don't know a lot about Medicaid and Medicare, but this is what it says. Medicaid expansion. In states that expanded Medicaid, individuals with low income, including those with pre-existing conditions, may qualify for coverage. And some examples of pre-existing conditions: chronic illnesses like diabetes, asthma, cancer, mental health disorders, depression, anxiety, for example, pregnancy or previous surgeries. The ACA was specifically designed to protect individuals with health issues, ensuring that they can access comprehensive and affordable care. Well, there it is. It's right in the name there, Affordable Care Act. Okay, so I don't see anything. Now, those are just basic provisions, the key provisions of the of Obamacare, if you want to call it that. I want to tell you, first of all, no matter where you go, every country has their own system, whether it's free, whether it's like in the UK and Canada, they have what they call something like the National Health Service. You can also have your own private insurance, but if you can't afford it or you don't want it, it is there for you free. Of course, there might be waiting times, and you might not be able to pick your own doctor. Those are, again, every country has their own different system. In Switzerland, your employer does not pay for your insurance. You do not get insurance through your company. You just don't. Perhaps there are American companies in Switzerland who do pay for their employees. They get insurance through their employees get insurance through their company. That might be. I don't know. They have different contracts, perhaps. somebody who is transferred to work in Switzerland, or an American who takes a job at an American company in Switzerland might be covered under the ACA, or they might have insurance through their employer. I don't know. It doesn't pertain to me. Again, it depends on your work contract. But in Switzerland, you do not get health insurance through your employer. It just doesn't work that way. You have to do it yourself. I want to show you a couple of clips from that I found on the TikTok regarding Obamacare and veterans health care and insurance and ACA and all of that, because I think it needs to be shown. I think a lot more people need to see these clips and wake up.
Okay, I'm sitting in my office. I'm whispering because this is unbelievable. This is my first opportunity to share. This is my first TikTok. But I had to come to my black women and share this. It has been a week. I'm still in my feelings, but that's beside the point. So I'm a health insurance broker. I'm actually a broker, but I do health insurance. So Medicare, it's busy season, individual, family, small businesses. That's what I do. I got a referral, right? About 2 weeks ago, one of my longtime clients sent me a referral. They had their appointment this morning at 9:15. They come in, it's a husband and wife. He got laid off from his job. They need insurance to start December 1st. I'm like, okay, no problem. Intake sheet. Most of my clients come from referral. No problem. They come in. I know what the situation is. I know most of the information that I need, but meet in person. Let's go through all the things, what medications you have, all that stuff, right? We're going through the information. We sit down, we're in my office, we're sitting down at the conference table. I'm like, okay. So as we're talking and we're going through, chit-chatting, he goes, the husband goes, because, I don't want Obamacare. And I'm like, in my head, I'm like, so what the hell are you doing here? You don't want Obamacare. Well, sir, I guess you're at the wrong place. He was like, what do you mean? The ACA is Obamacare. I'm not really sure what are you talking about? He said, I need the ACA. I don't need Obamacare. I proceeded to close my stuff. And I was like, I think it's time for you to go. So he was like, well, why? Sir, the ACA, the Affordable Care Act, dubbed Obamacare by the far right 10 years ago, by that black man who was in office in 2008 that passed in 2010, is Obamacare. So you're sitting in my office for the insurance plan through healthcare.gov in the state of red Georgia that you need to start in December because you have pre-existing conditions, diabetes, and early onset cancer, and you lost your job and you needed to start December 1st, but you don't want Obamacare. It's time for you to get out of my office. So he still does not believe that the ACA is Obamacare. So I come on over to my desktop and I type in ACA, I type in Obamacare, I show him. I was like, I really don't know what silo you've been living in for the last 10 years, but here you go. Bring out the information. I handed it to them, and I was like, thank you for your time. I opened the door. Goodbye.
So I'm in Walgreens, and there's this guy in front of me who's all decked out in his MAGA gear. The one with the daddy's home, with the fist in the air. Anyway, he's there with his MAGA hat on and his Trump shirt, and he's getting his prescriptions. So the lady behind the counter that's helping him lets him know, sir, I've noticed that you have Trumpcare as your insurance, and I'm just letting you know you should be getting a letter in the mail that we are no longer going to be contracted through them at the end of this month. He said, what do you mean? We got Selfridge right down the road. What do you mean you ain't going to be contracted through no veterans insurance? And she said, sir, There are a whole lot of administrative changes that are going to be going on, and Walgreens, the company, is unsure of what contracts through the VA, what contracts for the military are going to be revised or pulled. She says, now, I'm sure there are other pharmacies such as CVS or mail-in pharmacies such as Express Scripts that will still honor your insurance. But as far as Walgreens, we will not. And boy, did this man get so mad. He didn't understand what was going on. So she broke down to him what was happening. She's like, he's talking about getting rid of VA hospitals. He's getting rid of possibly disability for veterans. Or putting a 10-year max cap on that, and it's going to be an extremely hard process to even be approved for that. So this guy, he's just like staring at her, and he goes, well, shit, I don't know what I'm going to do. He said, the only thing that I live off of right now is my VA and my Social Security. And she just kind of looked at him, and I looked at him, and I said, they're going to be taking your Social Security too. And I looked down at his shirt, and I looked back up at him. I said, from one veteran to another, Daddy doesn't give a fuck if you have your medicine or not. He really doesn't. He doesn't care that you served. He deferred his freaking draft 4 times because his feet hurt. I mean, what do you expect from the guy? Well, Republicans are supposed to be all about their military. I said, this is not about Republicans and Democrats, sir. There's Republicans, there's Democrats, and then there's MAGA. And I said, and unfortunately, you're all a part of the MAGA. I said, hey, you voted for him. You fucked around, and now you're gonna find out. And I kind of feel bad because his face was just so like this was the first time he ever heard this. This was the first time he was ever hearing that as a veteran, his benefits, his security is being threatened. That his Social Security is being threatened. Like, where the fuck are these people staying? Where are they at? Like, living under a rock? I don't get it.
And you have to scratch your head. I think you really have to wonder, where do these people get their information? Well, they get it from Trump. They get it from their echo chamber, their MAGA echo chambers that says, Obamacare is no good. You don't want Obamacare. Okay, so these people think, yeah, okay, I don't want Obamacare, but there is the ACA and I want to get that. Okay, because I'm MAGA and I want only Affordable Care Act. I don't want Obamacare. So you have to scratch your head and think, where are these people getting the information from? They're getting it from Trump. They're getting it from MAGA. They're getting it from right-wing news. They're getting it from places that lie and people that lie.
This will be a strongly big picture approach to healthcare. Look, it will definitely have a forceful notion with a new wrinkle of reason. And when you run it up the flagpole and everyone salutes, because they will, because that's what they do when they like an idea. They like an idea and they salute it. But I have a total plan, a complete plan, and we have the Trump plan. It's Trumpcare. And the slogan is Trumpcare. We'll tell you when you're sick. And I think it's fantastic, and we're sticking with it, because that's what I do. Never surrender.
Remember, winter of our discontent. The authoritarian, the dictator rule will be starting January 20th, 21st. Day one, dictator. Day one dictator, Trump, will be dictator. And he will make those cuts. Look at the all of the people that he has nominated for his cabinet and other positions, billionaires. All of them billionaires. It is the wealthiest potential cabinet ever. At least 10 to 12 billionaires he has picked. And most of them have no experience in government, or they have no experience for the department that they are being chosen or nominated to run. Well, let's cut the... we're going to cut the, get rid of the Department of Education. Yeah, that's a good idea. Let's make the math and science scores even lower. Now, I said I was going to talk about the Swiss healthcare system and how that works. Again, they are just basic points. I'm not going over all of this, all of the fine tuning, fine tooth comb. But I'll tell you this: the Swiss healthcare system is one of the most efficient and high quality systems in the world. It has universal coverage, and it also I would say it has a strong emphasis on individual responsibility. So, key features of the Swiss healthcare system are universal coverage. What does that mean? It means everybody gets healthcare because everybody is required by law to have health insurance. That is the law. Okay, I remember when Obamacare was first introduced. That was, I believe, and I hope I'm not wrong about this, but I believe it was also mandatory at the beginning that health insurance was mandatory. But they came up with the Obamacare system, or the ACA system, to help people choose a way to have their health insurance. Okay, people didn't like that. They're thinking, well, you can't tell me what to do. You can't force me to have health insurance. I'm American. I do what I want to do. Okay, so they had to get rid of that idea. But here in Switzerland, it's not the United States. All residents are required by law to have health insurance. Okay, now, as I said earlier, you do not get insurance through your employer. Coverage is provided by private insurance companies, but the system is tightly regulated by the government. So, mandatory insurance means citizens and residents. I'm not a citizen of Switzerland. I am a permanent resident. You could think of me having a green card. Citizens and residents must purchase a basic health insurance plan within 3 months of living in Switzerland. And I did that when I first came here. Within 3 months. Basic insurance, that's all the law requires. Basic insurance, which covers essential medical services, including doctor visits, hospital stays, and medications. Now, I can choose my own doctor. I can choose my own hospital. Private insurance, the basic insurance is mandatory, but you can also buy any supplementary insurance for additional benefits. For example, if you want a private room in a hospital, or if you want dental care or alternative therapies, those are things that you could add on to your basic health insurance through your company. You don't have to, through your health insurance company, you don't have to. Many people do, many people don't, but everybody has the basic minimum. The insurance companies cannot deny you coverage or charge you higher premiums based on pre-existing conditions for the basic package. Okay, so how do you pay for it? The residents pay for premiums. They pay the premiums for the insurance, which are varied based on the insurer, the insurance company, the region, and the plan. There's a deductible, a minimum out-of-pocket cost, and co-payments, typically 10% of the treatment costs, which are capped annually. We don't have to go through a marketplace. We don't have to go through any brokers. So insurance companies here in Switzerland, they compete to offer the best value, but they must offer the same basic coverage. Okay, so now what does the government do? Well, the government regulates insurance companies. They set the standards for basic coverage and subsidizes premiums for low-income individuals to ensure affordability. Now, that is something that is very good here in Switzerland. The government has a mandate, and their mandate is that every person, every citizen, resident, asylum seeker is entitled to a certain basic standard of living. Whether that's from insurance, if they can't afford their own insurance, the government must help them. If for some reason your rent goes too high, the government must. When I say too high, if your rent or cost, whatever your utilities and things are, if they really get very high that you can't afford it, the government must help you. That is the mandate. That is what they must do. So, in the case of insurance, they subsidize premiums for low-income individuals to ensure affordability. So they help you pay your insurance if you can't afford it. Okay. I've had 3 spinal operations. Some years ago, back in the early 2000s, I could barely walk, and I had health insurance, and I was able to have my first operation in 2001. 2001 or 2002, I forget now which year it was. But after that first operation, I was able to walk. I'll tell you this, because when I lived in the United States and I had no health insurance, I would have been in a wheelchair for the rest of my life, at least through the 90s and into the first half of the first, until Obamacare came in anyway. I believe I wouldn't have been able to have the operation that I had to help me to let me walk again. I was in chronic, constant pain, 24 hours a day, and then the next year I had a second spine operation, and that also helped. And then I've had a third operation a few years ago because I have a degenerative and congenital, so I was born with a degenerating spine problem. So it just gets worse over time, and I'm sure I will need another operation or 2 in the future. I don't know when. I don't need it now, but I do know that if I do need another operation, I have health insurance that will pay for it. And so I want to give a shout out to all of my subscribers, the new ones. I know there's a couple of recent new people. Thank you very much for joining our community, and I thank all of my other hundreds of subscribers here. And I also want to thank President Trump, John Di Domenico, the impressionist, exemplary impressionist, John Di Domenico. You saw him earlier. He is very well known for playing the orange turd. Also, he is well known for playing Austin Powers, Dr. Evil, some other characters. He is a man of many talents and many voices, and he is a subscriber to my channel, though. So thank you, Johnny D, and I hope you don't mind me using your clip, but I love you, and more power to you. Thank you all very much for watching this video. I hope it helped somebody to understand what is going on, because there are people in the MAGA verse, I guess we call it the MAGA verse now, who don't understand. They believe the lies that they're told by the right. To everybody who's watched this video, I hope that you have learned a little bit something. I hope that I've helped some of you, and I hope I've also entertained you a bit with the help of Johnny D. So again, thank you all for watching, and you'll see me later.
Trump plan, it's Trumpcare. And the slogan is Trumpcare will tell you when you're sick.